There is an understanding that the quality of care provided in the Texas Medical Center, it's a very high standards. We do have a large pool of specialists, and this is one of the reasons why international patients seek to come to the U.S. for answers.
Baylor St. Luke's is rich in history for treating patients from all over the world. We have about 85 countries that come to Baylor St. Luke's for treatment, especially from the Middle East and Latin America.
There are countries where having an international insurance is prevalent. So these patients have a choice, and if they know that the procedure that they have is not one where their local physicians or surgeons are comfortable, they will come, and through the years, Texas Heart Institute and Baylor St. Luke's Medical Center has been a preferred destination for them.
The type of care that they look for are mainly in cardiology and cardiovascular surgery, gastrointestinal and GI surgery. Cancer is definitely one of the reasons why they come to Houston for seeking medical care. Then also diabetes and endocrinology services. And lately we have also seen an increase on transplant services needs in patients coming to Houston for transplants.
We were actually the first ones to implant the Viva Cortoral artificial heart. This represents a huge opportunity for patients that have not been able to get a match in terms of a heart transplant and that will otherwise die. These patients in the future can be eligible for a total artificial heart, and we have been pioneers for the last 60 years in that.
I think that one of the major challenges for international patients coming to Houston is definitely language barriers and cultural barriers at the same time.
We educate our staff and ourselves always about different cultures and how we can deal with it. What's good and what's not good, what's acceptable and not acceptable. So we take these things and make sure we understand before the patient even gets to Baylor St. Luke's. We want to put the patient, the international patient, at ease and make sure that we speak their language. We have staff that speaks Arabic, French, and many other languages. We also have a translation line that we can connect with for any other languages.
We can actually provide the entire care from beginning to end in Espanol. Now, the same thing applies, for the Middle East, for instance. We have also physicians from the Middle East. If you take a look at our faculty and our group of physicians, it's a very international group.
Baylor St. Luke's, it's very fortunate to have one of the best international teams in the country and in the world. The staff are people with heart that are committed to bring the best experience to the patient. We coordinate the appointments. We coordinate logistics. When it comes to understanding the Texas Medical Center, understanding Houston, it can be very complex and it can be very stressful. So our team is ready to assist with those logistics when it comes to lodging, when it comes to transportation.
We have an excellent staff that makes that trip much easier and more efficient for the international patient in terms of access, in terms of finding the right physician that takes care of them from start to end.
We do have a clinical manager that actually functions as a case manager. It's a key person that is in communication with the medical team here in Houston, is in communication with the patient, and is in communication also with the patient family, which is an important factor. Family wants to be aware of what's happening with their loved ones when they're in Houston.
We make sure that we accommodate their needs and be very culture sensitive to their culture and their language.
We would like to come to a situation where we have the different signs throughout of the hospital in different languages, so that the patients will be able to follow the signs in a comfortable way. We also need to make sure that the different brochures and the different materials are in the different languages, so that the entire care will be given in your language. Our international presence is so important for us that actually we have offices throughout the world. We have offices right now in Lima, in Quito, in Mexico City, and we just opened up one in Saudi Arabia.
One of the challenges for the international patient is actually post-treatment. Once they receive a treatment in the United States and it's time for them to go back to their home country to find the right physician to be able to take care of them afterwards. Our partnership with doctors in other parts of the world is very crucial to continue that treatment and provide continuity of care for our international patient.
Once we create the relationships, the patients start coming to us. More and more patients are looking for the opportunity of having an international insurance. They know what are the centers in the United States that will have the best outcomes, and this information is the one that they will use to select where is that they want to get their care. So we are expanding. Every day we are busier. Every day we are more integrated. Every day we are more global. Patients literally come from all over the world so that they can have these extremely complex cases addressed by a group of experts like us. It's a combination of excellence and also a very comfortable and personal patient delivery of care.
We're available to provide any kind of assistance 24 hours a day, 7 days a week, and they were always just a phone call away. We definitely are trying to be a home away from home for them and to make their experience at Baylor St. Luke's in Houston as less stressful as possible.